Mr. Speaker, sir, at the very outset, I would like to thank the honorable members, and especially the honorable member from Umroi, who has brought up this short duration discussion, which of course, as usual, turns into a long duration, but it's important in nature, and hence I appreciate that you have given sufficient and regulated time for all the members to raise their concerns. Sir, I'll go point by point so that we are able to address as many issues as possible. So the honorable member from Umroi had mentioned about the IMR, the infant mortality rate. And I would like to inform the House that after a lot of work that has been done by the departments, today the infant mortality rate from 34, it has come down today to 29, and we are almost at the national average because of the efforts that are being made by the department now. Even in terms of the SAM and MAM children, that is the malnutrition children and severely acute malnutrition children, the percentage has come down from 20% earlier to today at 1.7% based on the Poshan survey, which was done in March 2022. So the SAM and MAM numbers coming down from 20% to 1.75% is a huge improvement in the overall numbers, but of course we need to work harder. We had surveyed almost 3 lakh children, and when the survey was done, they found out that the numbers had come down from a 20% to today in the 2022 survey at 1.75%, and this clearly reflects the efforts and the outcomes of all the hard work that has been put in by the department and the government. Regarding the stunting issue, sir, it is of course a concern, and it's something that is more of a medium-term and long-term plan and work, because it takes some time for it to actually ultimately see the numbers and the actual changes taking place. But all the efforts that we are putting in, including ensuring that the Poshan programs are doing well and the SAM and MAM children are reducing, and also the fact that we have started this new early childhood development program where 40,000 more children who were never covered under the different programs of the Government of India, and 8,000 pregnant women who also were never covered will now be covered under this ECD program. And therefore a comprehensive approach and a proper life cycle approach is being applied to this, and all the different efforts that we're making will definitely lead to the overall improvement in the stunting numbers also, sir. So regarding the issue of the cancer problem, yes, it's a fact, sir, that we are facing a large number of cancer patients, and it is a matter of great concern. And we have had multiple meetings even at the state and the central level in order to address those issues. And there are many factors that lead to it. There may not be enough time for me to dwell on all those aspects. But of course, sir, in terms of treatment, you're aware that the new cancer wing in the Shillong Civil Hospital is already there, and that we will be, in fact, improving the services as we move along. I know that a number of members mentioned about it, saying that some radiologists or other technicians were not present. We will make sure, sir, that enough manpower and complete services are provided in this cancer wing which has been opened up in the Shillong Civil Hospital. So regarding the expenditure which honorable member had mentioned regarding the COVID, sir, yes, the numbers look very high, but sir, these were very urgent and emergent, I should say, situations. And we had to go the additional or the extra mile to ensure that we left no stone unturned when it came to the actual fight against COVID. Because these are very sensitive areas, we needed to ensure that we did everything in our capacity to ensure that we're able to provide different kind of services. I don't have the detailed breakup with me of all the heads, and it will take a long time. But roughly, sir, the numbers, some of the breakups are there in front of me, where we had spent almost close to 249 crores when it came to medicines, equipments, different supplies that we had to give. We spent almost close to infrastructural expenditure of 44 crores, 43.68 crores was spent. We had to spend almost close to 20 crores on incentives given to Ashas. We spent close to 14 crores where we give support to private hospitals. We spent about 17 crores for operational cost for vaccination, inclusive of campaign mode and support to public health services. We had given, there were a lot of IT interventions amounting to about 18.38 crores. There was human resource where we spent almost 19.5 and 8 crores, and so on and so forth. So there were many other areas, but just to give a rough idea, that these were the areas that we had to spend money on. But the important point to note here, sir, is that these were expenditures which we had to do. We could not take a chance with the human lives and the lives of our citizens. And being a very emergent situation, the government had to go that extra mile to ensure that we don't leave any stone unturned. And I'm happy to say, sir, that we saw results of that. I'm not saying that everything went perfect, but I think compared to a large number of other states, we were able to tackle the situation better than maybe most of the states. Of course, there were always challenges, but hence we ensured that whatever expenditure was required, we did not put a lid on it, and we ensured that wherever the health department felt that we need to spend, whether it's infrastructure creation, whether it's manpower, whether it's medicines, we made sure that we gave the full support, because it was a warlike situation at that point in time. Sir, the honorable member had also mentioned about different recruitments in different areas, and that is of course taking place as per the norms. He mentioned about the nurses, A&Ms, so that procedure also is on, and because of certain legal hurdles, certain notifications or certain decisions were delayed, but we will ensure that we expedite the matter at the earliest. Our honorable member from Meghalaya constituency had mentioned about Yalong Civil Hospital, and was mentioning that the ICU there had not been functioning. So as per my information, during the COVID time, the ICU was functioning out there, and it was, in fact, it was working quite well. But the honorable member has mentioned it. I have taken a note of it, sir, and definitely I'll ask the department to look into that matter. Also, he had mentioned about the fact that specialists and equipments were required in more numbers. And of course, sir, our endeavor is to ensure that we do that as far as possible, because this requirement is there in most of the hospitals and the sub-centers in the PHCs and the CHCs, sir. So he had also mentioned about the fact that there were the PHCs and CHCs in his area, some of them are not functioning well. So it would be more appropriate, I would request the honorable member, if he can, in fact, give us to us in writing, and we will ensure that we take up these matters, because we have a very large program where we are upgrading the infrastructure and the overall machine setups in most of the PHCs and CHCs. So definitely, if there is a need and if there's a specific information that can be given to us, we would be happy to do something about that and improve the overall services at the grassroots level. So he mentioned about the fact that the maternity beds were not enough. So yes, this has been a challenge in a lot of places, and again, the matter has been noted, sir, and we will do our best to ensure that we will try to improve the overall services and try to expand things wherever the financial options are there for us to be able to invest in these areas. But I have definitely taken a note of that point. So he mentioned about the 100-bedded hospital in Jowai. I'm happy to inform you that the local MLA from there, Mr. Mickey Shilla, has been continuously in touch with me, and after his detailed persuasion and push, I'm happy to inform you that the 100-bedded Jowai MCH will be inaugurated very, very soon. Was mentioning that the ICU also, that is for Yalong itself. As I said, sir, we will definitely look into that matter. So the honorable member also mentioned about the PHC in Block 1. I have noted this down, and so we'll definitely get this matter also examined. Mr. Meralbon, CM sir, the Honorable MLA from Nongpo had mentioned about the medical college in an aspirational district. And we are in fact one of the private universities, which is the USTM, is planning to lay the foundation stone for a medical college very soon on the 3rd of October, if I'm not wrong. And this, of course, is a private medical college, but nonetheless, it is being, it is going to come up. And the promoters there have given the proposal to the government, where they would like the government to be part of this in a PPP mode, where if certain investments are made, then they would share a certain number of seats for the government, but the running would be done by them. And hence it would be a great model for us to be able to invest bare minimum, get maximum number of seats for us, and not have the overall pressure of running the college, because that really is the biggest challenge. So we will definitely explore that option also, and I will be personally going there on the 3rd of October to be part of this very great program where the USTM will be putting up a medical college in their campus, sir. Sir, he had mentioned about the specialists and the equipments, which again is something that all the members have mentioned. And as I said, it's a process, and we are working towards improving that in most of the areas. So he also mentioned about the Mohalla clinic in Delhi. And of course, it's a good model and it's working well in Delhi. But sometimes the same models do not work in locations like ours, because Delhi is a more dense city, and the localities are close-knit, and also, of course, the manpower is more out there in terms of specialist doctors and other doctors also. So the situations are very different, what Delhi faces and what Meghalaya faces. And hence, all the aspects may not work in Meghalaya, but definitely, so wherever we find that the good practices are there, there is no harm in copying or learning from them, and we will definitely examine those matters also. So he had mentioned about the GNM and in Paham and the Marmiam PHC, so that the dates are being fixed for that, and I have informed the Honourable Member personally also that we will be going there. The trauma center, sir, I don't have the details right now with me, but definitely I've taken a note of it, and I will definitely get the matter detailed examined. So the ASHA workers he had mentioned, so we have already informed the House that a large amount of payments that were due to the ASHAs for the last, in fact, almost 10 years have been cleared to a large extent. Almost all the dues have been cleared, and ASHAs are a very important part of our health service sector, and hence we are ensuring that we leave no stone unturned to support them in every possible way, sir. So in terms of the maternal health, which was mentioned by the Honourable Member, many programs, for example, the rescue mission, the transit homes, which are basically homes where most of the high-risk mothers are kept 15 days, 20 days ahead of the due date, so that we can give them the necessary medical care at the same time, so that they don't have to travel during the last days or few days before the due date. And that would help in reducing the maternal mortality rate. So different kind of programs and interventions like these have been done in a large scale to provide the best service and to ensure that we minimize the maternal mortality rate in the state. And I'm happy to inform, sir, that in the last few months, especially from January to 2022 to May 2022, we have seen almost 40% reduction in maternal mortality. And just to give an example, in West Khasi Hills also during that phase, the year before we had 12 deaths, and this year it was only 2. But of course, I've always maintained that even one death is not acceptable. But just to show the comparison of how the efforts are making a difference, we have managed to reduce it to 2. But I keep telling the department that that number should be 0. So, so the efforts are working. But of course, as I said, it's a process and very complicated, and many factors are involved in it. But we are aware of the issues, sir, and we are doing our best to resolve those issues. Our MLA from Moplang had mentioned about the shortage of medicine supply. So there could be some situations where there are certain delays, and it does take place, sir. And that is the reason why we are under process of completely revamping the entire medicine supply procedure, including making it online, including the construction of different kind of storage spaces in different districts. And all of these processes are underway. I'm sure, sir, as we move along, we will be able to resolve this, or at least will be minimize the problem of medicines not being there. For example, the paracetamol he mentioned for the children's vaccination time, it was not there. So we will ensure in the future that these kind of shortages should not happen, and all efforts will be made in order to do that. So regarding some medicines that were not indented and they arrived, so these could be some errors that are there, especially when it's manually done. So therefore, we are under a process to computerize the entire indenting process, and I'm sure that once that is done, we will be able to minimize these kind of shortcomings that have been there. So he had mentioned that different tests, if they can be done for thyroid, especially, it's a good suggestion, sir. I have taken a note of that. He mentioned about the fact that people have to travel from Mawplang to Shillong, and I understand those concerns, sir. And that is why all these efforts that are being made is to reduce the overall hardship that the people have to face and the difficulties people have to face during such critical times, sir. So he had mentioned about the fact that we'll be expanding the sub-centers, but we have shortage of manpower. So we are, of course, there are 2-3 important points. When it comes to the sub-centers, so we are trying our best to ensure that it goes in a PPP mode. So we will have agencies or NGOs who will be working with us as far as possible, so that the manpower issue will not fall totally on the government. And hence, these models are working well in some areas, and in some areas maybe not as well as we expected. But it's a process, and an improvement takes place as we go along. But definitely, it's a point of concern, and we also are concerned about it. And that's why we have taken this approach of going for a PPP mode. At the same time, sir, there is a program for this, for our diploma courses for the doctors, where instead of having a long MD course, we are coming up with this Adarsh program, where every year we'll be giving diplomas for doctors. In 2 years' time, they'll be able to get certain diplomas, which will allow them to then function to some extent as specialists, maybe not be fully like a full MD, but then it will at least help us to reduce the entire shortfall in the manpower that we have. Sir, he had mentioned about upgradation of Pomlung PHC to CHC. Sir, we are under consideration of many such proposals, and just wanted to inform that I have noted that down. He has mentioned about the Mawplang CHC to be upgraded to a first referral unit. I have noted that concern also down, sir. So Mr. P.T. Sokme, our honorable member from Maulai, had mentioned about the PHC in Maudubot village. So we will definitely take a note of this. But of course, I don't have the full details with me right now. The sub-centers he had mentioned for Umprao village, I have noted that aspect also down. He was concerned about the MRI and the CT scan and other machines in civil hospitals, sir. They are working absolutely fine right now. The COVID expenditures, I have already shared the information when I clarified for the honorable member from Umroy, and I have given some of the breakups in that aspect, sir. The honorable members from Mawsangram, Mr. Hima Shampliang, had mentioned about the Sausampair PHC to CHC, which has been done, sir, and we hope that we'll be able to prove all the necessary things within a short time. The Veloy, Gillette, and the Dulia sub-center, which had mentioned, sir, the project in which we are taking up 200 plus sub-centers, these three will be in that also list. So the Dangar upgradation from PHC to CHC, sir, we are examining, and we will take the necessary steps as per the financial availability. There are a lot of demands from all over, sir, so we'll have to balance things out. He had mentioned, sir, about the hepatitis C concerns among drug users, and yes, sir, the MHIS in fact covers 2,100 rupees per day for the treatment for hepatitis C. Regarding the concerns of the operation cost for the craniotomy and the borehole surgeries that he had mentioned between 1 lakh being done for borehole and the craniotomy for about 70,000+. So these also I have noted down, but so these are areas where, as I said, the insurance companies have certain procedures that we also have to follow, and they have to discuss, and they accordingly, along with this department, we always keep certain funds for certain processes, and this is done in consultation with the state, with the health department. But sir, I have noted this point down, and we will definitely get this also examined in detail, sir. So Mr. Kimfa, honorable member from Ramrai, had mentioned about the need for more health services and centers in his constituency. He mentioned about the doctors and the manpowers and the need for upgradation and improvement of the trauma centers, sir. So I have taken a note of all these points that he had mentioned. Mr. Saling Sangma, the honorable member from Gambigri, had mentioned about the cancer care and the need for improving the overall services. Sir, as I had replied earlier, the cancer wing in Shillong is already set up, and even the information on so the in Tura, sir, so Tura also, sir, we are providing chemotherapy now, and as I said, the different machines, the chemotherapy and the radiotherapy are being provided in civil hospital. He had mentioned that one of the persons was not there for treatment, and because of that it led to the death of an individual, sir. So we will definitely ensure that in the future these kind of shortcomings and these kind of incidents should not happen, as every life is very, very precious to each and every one, sir. So he had mentioned about the MHIS and said that he's concerned about the fact that the money cannot be used for all the treatments. But so that is the nature of how insurance coverage is. And the insurance coverage is in certain amount for certain things, sir. For example, for the neuro surgeries, it's 1.28 lakhs coverage. For the craniotomy, it is 78,000. For high-end drugs, it can go up to 39,000. For CT scans, up from 2,000 to 5,000. So the insurance packages always work like that. So we cannot have that 5 lakh to be used for anything that we would want. And that's the nature of how insurance works, sir. But yes, we try to make it as much patient-friendly or as per flexible as possible. But it is not completely possible for us to make it fully flexible so that anything can be taken up. That in insurance, that does not work. At the same time, he had mentioned about the pneumonia cases in children. So definitely we have taken a note of this aspect also. The Korkutta MLA, Mr. Rupert, had mentioned about the sub-centers and that he's concerned about the different infrastructures. Some, in fact, improvement has been made. He was mentioning that the work is going slow in some of the areas. I can assure the honorable member that we will ensure that the works are improved and implemented at the earliest. And also the fact so that all the sub-centers that are there in the state, so we have decided that we'll be taking them up and we'll be improving the overall infrastructure in all the all the sub-centers in the state. And of course, the issue of the upgradation of Korkutta PHC to CHC also is under active consideration, sir. And yes, very soon we will be coming out with the official notification for that. The PHC in Adukri also, he has mentioned that it's in a bad condition, sir. I can assure the honorable member that we will ensure that whatever steps can be taken to improve the infrastructure in Adukri is also done. He mentioned about the sub-center in Chachnat and Agrapatar. So we will definitely look into the work and speed up the work in these areas. He mentioned about the dentists. So we are in the process of coming up with, we are actively considering, sorry sir, we are actively considering a dentist cadre also. But in the meantime, wherever it's possible, so we will try to work out to see that if the posts are there, then we'll work towards ensuring that these are all filled up and necessary services are provided at the grassroots level. Mr. Lazarus, our MLA from Chokpot, had mentioned about the maternal mortality rate. And sir, as I had mentioned already, that a lot of hard work is going into this. And this has been, in fact, the basis of a large number of other programs that have happened, including the self-help group movement, which I was talking about yesterday, started with our concern about maternal mortality rate. So I can assure the honorable member and all the other members that the maternal mortality rate number is one of the key bases and key points around which a large number of the programs of the state government are running, and definitely we are all very concerned and we are making all-out effort to ensure that this is reduced. As I said, sir, even in the month from January to May 2022, we saw a 40% reduction in the maternal mortality rate. Sir, the works, in fact, for the Chokpot CHC, which he had mentioned, the building, of course, is in bad shape, sir, but I want to assure the member that we are taking that up, and building renovation and infrastructure renovation will be done for the existing building out there. Regarding the 100-bedded hospital, sir, this matter has to be examined because this requires not just infrastructure but also manpower. But yes, Chokpot is a very area which is very interior and not connected well with the other headquarters, and hence they do require. So we will examine this matter, sir, and depending on the funds and other availability of resources, including human resource, we will examine this matter also. He had mentioned about the sub-center in Jetra. That also, sir, is something that we will examine. I've taken a note of that. He mentioned about the upgradation of the Rugapi sub-center to a PHC. We will definitely get this matter also examined, but I cannot give a commitment right now on the floor of the House. And he had made a general statement about the manpower requirement and technicians in Chokpot CHC. And yes, sir, this, of course, is a matter of concern, which I had mentioned that almost in every health center, this shortage of manpower is there, sir, but we are actively working towards trying to resolve the issues of the technicians and the manpower in almost all the areas. As he had also mentioned about the chemotherapy in Tura, as I've informed, sir, the chemotherapy services are available in Tura also, but of course we have to examine on having a full-fledged center in the near future, but these are things which have to examine and work towards. And so with that, sir, I have tried to cover all the points that the honorable members have mentioned, and with these few words, sir, and the clarifications, I would like to resume my seat, sir. Thank you very much.
Sir, I thank the Honorable Chief Minister for the extensive reply. One point of clarity, sir, on the sub-centers at Umkti and Nongtrao and the upgradation, the status of upgradation of the Umyam state dispensary, sir.
So I don't have the details with me right now, but I'll definitely get the information across to him, sir, after I prepare the information. So I'll personally connect with the honorable member and write to him and inform him about this,
Thank you, sir.
current status.
Sir, can I get one? Just one, sir. On this hepatitis C, sir. Just one, sir, please.
You're wasting time, I think.
So, Honorable Chief Minister had mentioned, I didn't catch, did the Honorable Chief Minister say on the hepatitis C that it is considered rupees 2,000 per day?
Yes. Yes, the current MHIS has a coverage of 2,000 to 5,000 for CT scan, but for hepatitis C, it is 2,100 per day.
Sir, that could be a bit slightly higher, sir, because the whole course
Now we'll close, I
would
think,
be
yeah.
60,000 to 1 lakh, sir, then. No, sir?
Yeah, I think we'll close. We'll close now. For the
I'll take a note.
short
I'll take a note.
So short decision discussions come to a close now.